Namaskar and welcome to the special webinar series of Hindu Council of Australia's Victoria chapter. I'm Jay Bharatwaj from Ethnic Link Labs, your moderator for tonight. Today we'll be discussing in this whole 1 hour myths and misinformation surrounding the COVID vaccine. Uh, we can see in Victoria, in Australia, COVID vaccination is on full swing. However, there are some hiccups, and we will be talking about those hiccups, why they are happening. Let me introduce you to our panel tonight. First of all, I would like to welcome Makran Bhagwatji, who is the president of Victoria's Hindu Council of Australia chapter. Makranji, thank you so much for joining to us. Second is Dr. Mandar Gokhale. He's a general practitioner in Mornington Peninsula, that is regional Victoria. Mandarji, thank you so much for coming here. And our third panelist is Dr. Sanjay Sharma. He's consultant anesthetist in Ballarat Health. Sanjay ji, thank you so much for coming. And the final panelist joining us is Dr. Manjunath Nadigar. Dr. Saab, thank you so much for coming here. With this esteemed panel, we'll be discussing very important issue which is pertaining the community, myths and misinformation surrounding the COVID vaccine. However, to start the program first, I would like Dr. Makran Bhagwat. Makranji, I'm saying doctor to you too, so that's good. Makranji will be telling us what Victorian chapter of Hindu Council of Australia is doing in terms of fighting this misinformation which is spreading in the community, especially the Indian Hindu community we are talking about, but wider communities are also concerned about these misinformations. Makranji, over to you. You're on mute, sir. Yeah.
Yeah, thank you, Jitaji, and thank you being a moderator for today's webinar. I would like to begin by acknowledging the Wurundjeri people, the traditional custodians of this land on which we are all virtually gathered today, and pay my respects to their elders, past, present, and emerging. Hindu Council of Australia Victoria chapter is very happy to present this webinar today on an important subject of the COVID-19 vaccination, and this has gained a lot of momentum here in Victoria. Since the recent outbreak in Metro Melbourne, it has become even more important for all of us to get vaccinated. So on behalf of the Hindu Council of Victoria, Hindu Council of Australia and Victoria, I thank Dr. Gokhale, Dr. Sharma, and Dr. Manjunath for accepting to be our panel members. Thank you very much, and I really appreciate it. So I'm pleased to mention here that in the past week or so, HCA Victoria has released short videos on our Facebook page in at least 9 languages, informing the community members about the virus spread in the recent time. And we are also urging them through that video to come forward for testing if anyone has slightest symptoms. I also take this opportunity to thank all those volunteers who presented themselves in the video in their own language in making these messages possible. So this video messaging was basically done on the advice of Department of Health and Human Services and Victorian Multicultural Commission, and their data points suggested that there were not enough people from the CALD community, which is culturally and linguistically diverse community. They are coming forward and getting tested during the current testing blitz. So further to these efforts in supporting DHHS, we are now moving on to this webinar, where we will understand from all these eminent doctors about the common myths and misunderstandings about the AstraZeneca and the Pfizer vaccines being rolled out in Australia, which will hopefully encourage our community members to come forward and get vaccinated. There are many questions people are asking around depending on their circumstances, and there are lots of questions moving on in social media. As we all know, WhatsApp University is spilling with so many suggestions from experts, but in people's mind, there might be some confusion. So what should we do here in Victoria, and particularly in Melbourne, for getting vaccinated if you're not already vaccinated? So this is an opportunity for us now to hear from our panel of doctors, and I look forward to a very, very interesting conversation with them. Over to you, Jayji. Thank you.
Thank you so much, Makranji, for a beautiful introduction. Uh, let me throw it to the experts who are our doctors, because they are dealing with the patients like me. They are dealing with the calls from people like us, and no question is a stupid question in at least in these circumstances. So I'll go to Dr. Manjunath first. Dr. Manjunathji, what is myths and misinformation about COVID-19 vaccine? What are you hearing, and what will you suggest to people?
First of all, thank you very much for involving me and inviting me for this very informative session today. And yeah, you raised a very sort of an important question when it comes to the vaccines that there is a misinformation and sort of misunderstanding in the community about the vaccines. Look, all vaccines, there are so many vaccines we have, and the COVID vaccine is one of the such vaccines. It's called as a recombinant vaccine, where first of all we have to remove that myth that it doesn't have any live viruses in it. It doesn't have any live viruses in it. How we get into the influenza or polio vaccine, something we have. So it is a recombinant vaccine. What is a recombinant vaccine is you're just going to put it in a very general term, we just study some of the information which is present on the virus outer layer, and then we're going to copy so that our body can learn from this. And we are preparing this in the lab, and then we are injecting to the people. So there is no virus in it. So what it does basically is when you inject to the person, so our body doesn't know it's a very totally new viruses, which is a new to our system. So there is a possibility that people can get infected into to a lot of disease and complications, so on and so forth. So before you do the vaccination, when you do the vaccination, so then the body will produce some of the something called as an antibodies. Then you will get prepared when the infection happens. The body is able to fight with it, and the person will not get any sort of severe symptoms what we usually expect. In terms of you raised little myths about it, so many people had, and there are some things which are coming in the media that this one particular vaccine from the called as AstraZeneca will have clots and people can die because of that. Well, there are some incidences, as you know, unfortunately, happens. Nothing is, completely safe when you talk about medicines and vaccines. There will be always some risk associated with it. But what we see is how much benefits are there and what are the risks are there we have to when you evaluate. The risk with this vaccine is very, very, very low about that. I mean, you're getting very severe complications. So most of the people are getting these vaccinations without any much of a problem. There will be some normal sort of side effects, we call them, are there the local or a general or systemic side effects we call, so which are there for most of the vaccines. So it is not that if you get vaccinated you are going to die or something. It's not there like that. But there is a very, very rare complications if the people are thinking about it. So the benefits are very many. So there are a lot of benefits of vaccine. So you're going to protect yourself. You're going to protect your community. So I think there is a strong message that vaccination can improve the herd immunity as well. So it is going to protect in terms of if you think of fighting this virus and fighting this disease, it's a very important step.
Thank you so much, Manjunath Ji. Okay. Well, let me go to Dr. Mandar. Dr. Mandar, what Manjunath Ji is saying is there is some role of media also, which has probably I don't know, reverberated this myth or somehow unknowingly or knowingly. But how do you see that? What do you hear from your patients who come to you or the community at large about these myths and misinformations about COVID vaccine?
First of all, thanks for having me. GPs now in Victoria and in Australia have been vaccinating patients for the last 12 weeks. So we have a lot of experience of vaccinating people. There's always fear with any new technology, anything new that comes out. And I think the media tries to give information. Sometimes the way that can seem alarming to our patients. We always, hear about clotting, and every time there's a group of patients that do develop the very rare side effect of a blood clot, the media gives that information, but people interpret that, they perceive that as being something that is very serious, that is very concerning. And as far as doctors are concerned, these side effects that we're seeing are actually what we'd classify as being very, very rare.
Dr. Mandar, but still, why these concepts are coming? People are, if you see the social media, is busting of certain misinformation. So how do we combat them? And what are if I ask you, what are the three biggest issues which are put on you by your patients?
It's very difficult because there's a lot of information out there. People are Googling constantly. There's Dr. Google, which seems to educate a lot of people every day. But we're seeing a lot of patients coming in that are, attached to WhatsApp groups and some Facebook groups that really do spread a lot of misinformation. So one of the most important things is for patients to try to find out for themselves where that information is coming from, and to get the accuracy from reputable websites. And the government in Australia here, we have a lot of government-based websites that patients can really check information on. I think as far as other kind of conspiracies that people are worried about is many patients come and say, but COVID is just a mild infection, so why should we be vaccinating? And we've been very fortunate here in Australia that our numbers have been so low that most people and even most doctors will not have actually seen a patient with COVID infection. So it's very hard to try to educate people that this is a serious infection, and see what's happening around the world, and particularly in India, to kind of get that feeling that no, this is actually a serious issue for the whole world.
Okay, let me go from Victoria's southeastern end to northwestern end. Let's talk to Dr. Sanjay Sharma. Dr. Sharma, what are you hearing? What is your understanding of myths and misinformation around COVID vaccines?
Thank you very, very much for having me, Joy and Makanji, on this forum. Now, look, I think a lot has already been said, and particularly I thank the GPs on this forum today, Dr. Mandar and Dr. Manjunath. I think they are real frontline people who are dealing with people particularly affected with COVID, or also, vaccinating people. So really, that's a big service to the community that the GPs are providing. Now, in terms of myths and misinformation, again, I would say that, bad news always travels faster than the good news. And there is lot of good news that's there, but media or people who are actually, benefiting never ever talk about that. It's like, we say in our hospital sort of environment, the squeaky wheel always gets the attention. So it's, usually the people who complain the most or who have some sort of agenda, they always get that attention. And that is where, the problem is that we know for a fact that for a long time, the anti-vaxxers have been around, and that anti-vaxxers lobby is really, really strong. From the time of MMR, you guys know the measles, mumps and rubella vaccine. There was so much misinformation spread around that time that people started, believing that their child is going to get affected by this or that, and lots of those kind of misinformation, which is still prevailing. It has not gone away. So the problem is that that sort of misinformation we have to deal with as health professionals, there's no doubt. And as responsible people in the community, I think we need to educate and make people aware that it's an important thing, that we need to keep our eyes and ears open and see what's going on around the world. As we just heard from the other panelists, that so many people have been infected and unfortunately died because of this COVID infection. I was just reading today, only 173 million people have been infected around the world, and unfortunately about 3.75 million have died as a result. So obviously we have been very fortunate in Australia to not have to see that sort of numbers, but that doesn't mean that we can't actually have that problem. We can have that problem, and we need to be very, very mindful of that, and try and use the best strategy that we have. And what's the best strategy? The best strategy is prevention. And what are the things that we can use for prevention? The things that we can use for prevention, of course, we know that you should be washing your hands, you should be wearing masks and doing social distancing. But now, in the last 1 year that the world has been grappling with this COVID sort of pandemic, and the scientific community has raced to find a solution in terms of a vaccine. We need to, basically adopt that strategy and say that we are going to take this and get rid of this COVID kind of, pandemic that we are facing today.
Definitely, Dr. Sanjay. Thank you so much for your remark. Eh, I'll take it forward to Dr. Mandar. Dr. Mandar, what Sanjay was saying was from measles to now COVID-19 vaccine. But the stakes are much more higher right now. People can really die because of COVID-19. And more than that, the spread. You might not feel any symptoms, but you can be a carrier for that, and you can spread it to a number of people. So stakes are very high. So how do we make people understand that it's a very important vaccine, and they have to let it go in terms of their spectics? Dr. Mandar is on mute.
Yeah, it is very difficult, and particularly, as I said before, because in Australia we don't really understand how severe these infections are. We don't see our loved ones in hospitals, in ICU, having to try to get treatment, trying to get oxygen, as we've seen happen in India. So it's actually very difficult to try to get people to realize how severe this can be. But I think if we think of it in terms of, we need to get the world back to normal. Indians love traveling, and I know a lot of people are wanting to get back to India to see their families. This is really a way of speeding that up. If we all get vaccinated, that might speed in that process of being able to travel within the next few years.
I'm one of them. I really want to travel to India to see my parents, but because I was not in that bracket of age limit to get the vaccine, I couldn't. But as soon as I am, I'll be the first person to go there. And let me get Manjunath there. Dr. Manjunath, is that your concern also? Are you telling your patients also that yes, traveling is very important. You can only travel because of that. Yes, we have example of UK, which has opened up because a large number of population there has been vaccinated.
Yes, I think vaccination definitely helps. As you know, that other countries, as you mentioned, UK and all, they have opened up because they have vaccinated large group of population. which is a bit slower in Australia. So once you get vaccinations, yeah, they can create something called as a travel bubble, when there is other countries can be involved where there is a large vaccinations happened and there is a no much of the cases in the community. Yeah, then the vaccination can, no, the travel can happen. But although we are living in a lot of uncertainty, the vaccination is the first step, which has, which can increase a bit of a herd immunity, which can contain this virus to a significant extent. At the moment we don't have any other sort of resources to do, I mean, lot of other things to do to contain this. So one is the vaccination. So I mean, if you vaccinate, yes, as you said, a travel bubble can be possible, and then you can travel to the countries where there is a large vaccination happened and the number of cases have been very low. Yeah.
Okay, I'll put a very specific question to you. A lot of people are talking about that COVID vaccination can, because of this vaccination, not right now, but there is a very big possibility of people dying within 2 years of vaccination. So, how do we deal with this kind of like rumors mongerings?
That's absolutely a misinformation, and no one is. I don't think so. People who get vaccinated die in 2 years. I don't think so. That is true. No, I mean, actually, it's going to have more benefit than that. I think the travel and other things what you mentioned. So that is not true. Yeah, I mean, there are complications. I agree, but not as you said. I mean, why this clot thing has come is, you need to understand. In Australia itself, if you take, when they vaccinated 2,254,000 Australians, when they vaccinated, the number of clots or whatever said with AstraZeneca, they said hardly 27 of them. That too, a number of deaths are so low. They've been all hospitalized and they recovered from the complications. So you can think of where is 2,254,000 people, and where you're getting some few like 27 and all. The chance is very, very rare. It's and also not everybody who get vaccinated is not going to die in 2 years. That's absolutely false. Yeah.
Okay, let me go to Dr. Sanjay Sharma. Dr. Sharma, the part of world where we come from have had so many Google searches done and social media posts also. And they said that this vaccine, this COVID vaccine, can cause impotency. So that is the reason for a lot of people trying to avoid the vaccine. I don't know why, but this myth is there. So how do we deal with that? You're on mute, sir.
Oh,
Yeah.
okay. So thanks for asking that question. I think, again, it's, I suppose, as we were talking about Dr. Google and WhatsApp University, and lots of those social media platforms that cause all these kind of anxieties. I can say, and I'm sure lots of, particularly the two panelists here who are frontline workers would have had their vaccination, and I'm also one of those who have had vaccination, and I can tell you definitely that's not the case. So 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 that's the, one myth out there. Although you can say it's n is equal to 3 in, the particular sort of situation that we have here, but I can tell you lots and lots of, people who have been vaccinated around the world. In fact, I was just reading just today before the webinar that 300 million people have actually doses of vaccine have been administered worldwide, and 150 million people basically be vaccinated. So you can imagine that, if 150 million people have been vaccinated, and there isn't anything that I have heard in the media or in my scientific sort of journals about impotence with this vaccination, then it is absolutely a myth and nothing else at all. I mean, if you want to believe something, you have to believe the scientific data and not, some Facebook rumor or, a WhatsApp rumor. You have to believe the scientific data. Yes, there have been, things about like clots and things that we were just discussing. Now, even that, I suppose, as we just said, that, the risk benefit of anything we have to weigh very, very properly. So risk benefit is definitely there. And I say to a lot of people, like when I do give anesthetic to people, I say to people that anything that I do carries a risk. There is no doubt, but there is also a risk in crossing the road. If you go by Vic Road's statistic, what's the risk of crossing the road? Jai, can you tell me?
It could be quite high.
Yeah. So the number is, if you are crossing the road, you can actually have a mishap. To a figure is 10,000. So
Wow.
one in 10,000 people actually could get a mishap just crossing the road. And I'm sure a lot of us actually drive cars, and we can also have mishap on the road. There could be a flat tire, there could be, a windscreen broken, there could be, something that, suddenly somebody else comes on the way. Lots of those kind of things can happen. But do we stop driving car? No, we don't. So those kind of things, people need to understand that everything we do in life actually carries a risk. In fact, even sitting here in this room carries a risk, because the roof can actually fall on my head. What do I do?
Well, I'm
So
buying your argument, Dr. Sanjay. I'm really buying your argument. Let me pin in Dr. Mandar. Dr. Mandar, are you giving both the vaccines? Somebody has asked me this question: that are you at GP clinic giving both the vaccine or one of them? And I have a supplementary question. I'll ask you after this one.
At the moment, we are only giving AstraZeneca. This was the vaccine that we were given initially to give to people over the age of 70. That now is we are doing over the age of 50. But the government has recently said that GP clinics will soon be able to give the Pfizer vaccine to people that are eligible for that between 40 to 49. So at the moment, we're just doing the AstraZenecas, but in the next few weeks, we'll actually be hopefully giving Pfizer vaccines to eligible people in that age bracket. It's very important to realize that if you're over the age of 50, you can only really get the AstraZeneca vaccine unless you fulfill very specific criteria that you can't have the AstraZeneca vaccine if you've got a certain medical background, but your GP will be able to tell you if you fulfill that criteria.
Okay. The next question to you is, this is a flu season in Australia right now, and Melbourne is known for its flu havocs, So what do I do? Shall I get flu vaccination first, or my COVID vaccination first? What is the gap between a week, after a week of my flu vaccination, I should go for COVID, or vice versa? What is the concept behind that?
So at the moment, you do need to have a 2-week gap between having a COVID vaccine and having the influenza vaccine. So if you have your influenza vaccine, you have to wait 2 weeks before you get your COVID vaccine. If you're having your second COVID vaccine within the next 2 weeks, then it's not a good, you can't have your influenza vaccine now, because then before 2 weeks is up, you'll be having your second COVID vaccine. So there has to be a 2-week gap either side. The reason for that is that we really want to capture any side effects that people get with the COVID vaccine. If you have both vaccines together and you get a mild side effect, or even one of the serious rare side effects, then we need to know which vaccine actually caused it. And that's the only reason why these vaccines have been separated. They're actually quite safe to give at the same time or within the 2 weeks. But what we have been doing is making sure that there is a 2-week gap.
Beautiful. Let me go to Dr. Manjunath first, and then I'll go to Makarand Bhagwatji. He has a question for all of you. But let me ask Dr. Manjunathji. All right, sir. I have made my mind that I want to take the vaccination for COVID-19. But what shall I look forward to? What happens in the first few 3, 4, 5 days? Because I'm very scared. I don't know what will happen. So please outline what happens if you take the vaccine.
Usually, you will see that any vaccine will have a little bit of side effects. So most of people will find it, but some of people don't have even anything at all. In my sort of a patients, when they get vaccinated, they tell me they didn't feel anything, and some of them they said they had a bit of a arm pain and a bit of a headache and all. So generally, we class them into the local and the systemic side effects, which we usually see with both the vaccines. With in comparatively, what the studies have said is like local side effects are a bit more common with Pfizer, and systemic side effects are more common with the Pfizer one. What does that mean? Is local means you have a bit of an arm pain, a bit of a redness, and a bit of itchiness where the injection site is, and a bit of a glands maybe coming up in the under the armpit and those sort of things. In the systemic way, you can say some people had even like a diarrhea, headache, and a bit of a fatigue feeling, and those sort of things can be classed as systemic. This is common, and they don't be for long. Maybe like few days they will have. Some people have 1 week and all. It will settle. It's going to settle. So side effects are expected. Very small number of people even don't have any sort of side effects at all. So that is also there. So we don't have to get scared that we have arm pain or what I'm going to do now. So it's simple, and remedies will be fine. Yeah, I mean, I don't think so. It's an issue, a big issue. So if you get a bit of arm pain after a bit of a redness there and itching, it's okay. It might settle. I mean, most of the times it settles without any having any further repercussions of that. So yeah, I mean, local side effects are quite common, which are quite expected. And systemic side effects are also expected, which is most commonly seen in these vaccines are headache and bit of fatigue. So a lot of people complain that one after that, and they take a rest, and after a few days a week, and that also settled, and they are all okay. So these can be seen, but they settle after a few days. There is nothing to worry.
Okay, let me give it to Makranji. Makranji, you wanted to ask something. Please go ahead.
Thank you, Judge. I had a question about Pfizer for Dr. Mandar. And just before that, on to what Dr. Manjunath was saying, I had my vaccine done on Thursday. I had the AstraZeneca one. And yes, there was a reaction. Me and my wife both got vaccinated. She had a bit more reaction, like fever and continuous body ache. I had some body ache, but few Panadols per day, and everything is gone. I don't look like I had any reaction now that I'm talking to you. So I think any small reaction is expected. But coming back to this Pfizer one, which the GPs are shortly going to administer, Dr. Mandar, when the Pfizer vaccine was rolled out last year, they were saying about the minus 70 degrees storage requirements and so. And then at the time, government said, oh, we don't have facilities at the GPs now because they require some specialized freezers. But now that GPs are going to roll it out, is it true that the Pfizer vaccine can now be stored at higher temperatures? I mean, the normal refrigeration temperatures?
Yes, that's true. Initially, when they came out, it had to be stored at minus 70. Now the company has revised that, and the vaccine is quite stable in a normal vaccine fridge for a period of up to 31 days. So GP clinics will have normal vaccine fridges, which keep vaccines at around 4 degrees. And the Pfizer vaccine has now shown to be stable. Now that they have done more research on it, they realize that it can be stored in a simple vaccine fridge for that length of time. And that's why the government will shortly roll out Pfizer vaccines to GP clinics.
That's quite good news, I suppose. But let's go back to the people who want to get vaccinated but are hesitant. So, what is your advice, Dr. Sharma, when it comes to pregnant females or people who are not that healthy, if I could say?
Look, I think my better half would be a better person to actually talk about this, but she's an obstetrician. But I can maybe talk on her behalf and say that, and probably the two GPs here probably would be a better people to actually say on that issue as well. Whatever my understanding and reading is that, I mean, obviously, studies in pregnant patients and children is usually not the thing that happens and it is very, very difficult. But I believe that it's not an issue that patients who want to have vaccination, they should basically they don't need to actually worry about it. They probably should be able to have that. That's what I think. Dr. Manjunath and Dr. Mandar probably would probably elaborate on more. I'm sure, but from my understanding, it's not an issue. And the second thing, with regard to the people who are in immunocompromised state, it would be something that I suppose again they need to consult with their GPs and maybe the specialists that they are under to get a proper, information on whether or not it is good for them to have the vaccination or not. But as we were talking about it, that there will be definitely a certain number of people who can't actually have vaccination, and that's where the herd immunity comes in. The herd immunity actually helps, particularly, because there will be at least about 10 to 15% people in the community who can't have or will not have. And if 80-85% of the community actually has vaccination, then that herd immunity actually then protects them because the virus is not able to move around. Your
I'm sorry, I was on mute. Dr. Manjunath, it's not necessary that you should have a Medicare card when you're going to your GP for vaccination, is it? You're on mute, sir. Dr.
Sorry?
Nath?
Okay. Oh, sorry. Yeah. I don't think so, because naturally, there is some Medicare card. We have some item number, something like that. We use that. I think even non-Medicare card holders also can get this vaccine without any much difficulty. Yeah. You're on mute.
The regulation of the time is that you don't need a Medicare card, regardless of your visa status. In Australia, you can get a COVID-19 vaccine for free. It's for free for everyone who is in Australia right now, and you don't need to show your birth certificate. You don't need to show anything to anybody to get a vaccination. It has nothing to do with your visa status or your Medicare care card or whatever you want to talk about.
Correct. That's right.
Another question, let me ask you that once you have had this vaccination, what after that if in what conditions should I call my GP, or I should be concerned about my health if something is happening, and I should be calling out for help?
I think most of the side effects have been already explained. When they give vaccination, wherever you go to vaccine center, they got a lot of information, what side effects you expect and all. If that is the case, you don't really have to worry. As I said before, they'll just pass by, so you just have to wait. And then if you feel something is more serious, like say, for example, a very severe headache you are getting, or the arm is really swollen and red and all, and any other things, I mean, you feel a bit of a chest tightness or something, like any symptoms, so that is more not mentioned in the usual things, and you are getting, so it's better to go and check yourself with consult your GP, or even to give the ring to that vaccine line. So they have given, there is an information line, so they can call them, so they will also explain. But any of the other things, any severity is there, you have to contact your GP, or even go to emergency in some cases.
I'll go to Makranji. Makranji, you had a question for us.
Yeah, the information which the government is distributing to all the communities is coming back to your Medicare. If a person books an appointment at a GP to get vaccinated, then a Medicare card is required. But if that person does not have a Medicare card, then he or she can go to any mass vaccination centers which are being run by the government at multiple places, and nobody will ask for any Medicare card. It is absolutely free. They just take down your phone number and your name so that they can contact you the second time for the second dose administration, and that's it. So a lot of Indian community members whose parents or students or anybody else who don't have a Medicare card, they have this concern that how am I going to get vaccinated? Is it going to cost my money? Like back home, for example, it is not true. It is all free. Only for GPs, Medicare is required. If you go to mass vaccination centers, it is free. Thank you.
Thank you so much, Makhanji. Okay, Dr. Gokhale, tell me one thing. Uh, there are two doses of the vaccine. So I have had one. How secure am I?
You would have had the AstraZeneca vaccine. Are you over 50?
I'm not sure. I haven't had. I'm just asking you a question.
Oh, okay.
I don't know. Do I
I was
look
trying
like
to guess your age.
you're killing me now?
If you have the AstraZeneca, with both vaccines, the efficacy after the first dose is actually quite high compared to many other vaccines. The efficacy increases with the second dose. So it's very important for people to realize that to get fully protected, you are close to 75 to 80% protected after the second dose. And that does take time to develop immunity. So the message is really to get vaccinated as soon as possible and not wait for an outbreak. After the first dose, the efficacy is up to like 50 to 60%, but then that really increases after the second booster dose, which is at 12 weeks, ideally, for the AstraZeneca, and after 3 weeks for the Pfizer.
Dr. Manjunath, I'll take it from what Dr. Gokhale is saying and go back to you. All right. These are the numbers for efficacy of vaccines, about somewhere 75 to 80, 85%. What happens if I've had both the vaccinations of either AstraZeneca or Pfizer? What is my chances of, or what are the probabilities around for getting COVID-19 positive at that point in time, or spreading it around?
Well, I think when you say spreading, you should be infected first, or you should be carrying that virus. I mean, if you're asking me about the reinfection chances, you might be infected still, even after the vaccination. But what you may not get that severe symptoms or severe reaction to the virus, or what virus infection complications have. You don't get them. But there is a reinfection. Yes, you even after vaccination, you might come across, you might get exposed to it. But I mean, transmission is also reduced. I mean, if you are not having severe symptoms and all, that is less likely, you will transmit it more frequently than the person who has got a lot of symptoms. So there is definitely a reduction in the spreading as such. I don't say there is no spread, but there could be reduction in the spread after the vaccination. It can help. And also, even though you're reinfected, the chances of you getting into the very severe form of the diseases by the virus will be less.
Dr. Sharma, how are you? I'm putting the same question to you too. How are you seeing this? People are asking about, all right, even if I had the vaccines, I might get infected. I'm very healthy. I'm 40 something, 35 something. My chances of getting severe COVID are less than what probably different people. So why should I get it? This is also argument that efficacy is somewhere 80%. So there is always 20% chances. So what are you hearing from your patients and the community?
Look, basically, as we just said right at the start, that we have been lucky in this country not to see that sort of numbers. And as Dr. Manjunath and Dr. Gokhale said, that there have been probably not even GPs who have seen COVID patients. At the start of the pandemic last year, in the regional Victoria hospital here, where we normally have 8 ICU beds, ventilated beds, we were asked to ramp it up to 68. So obviously we were kind of, very concerned seeing the numbers in Italy and UK and many other places, that we were thinking that we will probably get those kind of numbers. We have been lucky. We actually didn't get those kind of numbers, but what I have, heard from a lot of my, colleagues in the US, in UK, and in India as well, there have been lots of young people who have actually had diseases. The COVID, particular severity of the disease has been pretty high that they needed ventilation and they actually had to be in ICU. And unfortunately, quite a few of them have died. And so we need to learn lesson from the other countries rather than, get into that situation and then learn from it. We can learn from other people's lessons. We don't need to, learn it hard way ourselves. So that's my suggestion to anyone in the community who is thinking that I'm young and I won't get it, and the chance of the vaccine providing protection is only 80%. I mean, these are numbers. Also, to keep in mind is that the vaccine will help you to protect against getting the severe form of disease. So you don't need to go to hospital. You don't need ICU. You don't need ventilation. You don't need all those, serious kind of treatment. And let me also emphasize one thing that, those who actually have had disease, it's not just something like cold and flu that you suffer for a week, 10 days, 2 weeks, and you get over it. There are a lot of people who actually have had COVID and they have been suffering for months, even till like some people have had infection last year in the first wave, and they are still suffering from lots of these symptoms that affect lots of systems, not just lungs. As we know, lungs obviously do affect, but there are so many sort of systems getting affected that right from head to toe people get so many kind of possible system affected that they are almost kind of not able to do anything productive. That's the kind of disease it is. And there's a some entity called long COVID. The two colleagues who are here on the panel, they will concur with me. I'm sure that long COVID is a definite entity, and many people actually, after getting the COVID and getting treatment and fortunately surviving, they still continue to have those symptoms that makes them very sick for a long period of time. So my own advice to everyone who is listening and seeing us is prevention is better than cure. Go and get the vaccination and let it not actually affect you in the first place.
Wow, thank you, Dr. Sharma. This is the message we want to relay to everyone who is listening. Dr. Gokhale, want to quickly come to you and ask, if somebody has had a COVID positive test and after 15, 20 days, whatever the course is, they are COVID negative. So when is it safe to take the vaccine after that?
So it is safe to have the vaccine even if you've had a previous COVID infection. And the current advice is that if you have had a COVID infection, either overseas or locally, you should still get vaccinated, because that will increase the protection against getting reinfected, which can happen with COVID.
A last leg of our program. I'll let all the doctors to answer a few questions which probably Makranji has, and few questions I have received from our people who are listening to us. Makranji, I'll let you ask the question first, and then I'll go to the questions which I'm receiving from people watching us. You're mute. Makranji, you're mute.
I think one of the questions which I was going to ask was already asked, and the question was related to the fact that I think Dr. Sharma answered it. Even if you have both the doses of the vaccine, there is still a chance that you can still get infected. But the main point to be noted there is even if you get infected again because of a new variant, for example, the impact of that infection will be significantly low because you already have a vaccine administered or both the doses administered. So I think we, all of us, are going through this very risky business of these variants which are coming through. And the question which I was trying to ask then is, even if we have two doses, say during at the period of say some, I think AstraZeneca is 12 weeks and Pfizer is probably slightly more or less, I can't remember. Say if you are in 2022, so which is 6 months from now, and if there is another variant, then would there be a scramble amongst the vaccine manufacturers to come up with a new variant of the vaccine, just like the flu vaccine we have, and then we have to again line up for the vaccination next year and the next year and the next year? So is it a new flu?
Probably that's the question of a lot of people. That is it the next flu? Probably I'll ask. Start with Dr. Gokhale and then go to Manjunath ji. Dr. Gokhale.
Yes, so I think what vaccine manufacturers are looking at doing is probably tweaking this vaccine, making it effective against the newer strains. And what we'll see over the next 12 months is probably some development in the vaccine to make it better and make it effective against some of the newer strains that are coming out. It's highly likely that in another 12 months' time, people will need to have a booster vaccine. And it may very well be that this becomes a part of an annual vaccination for who knows how long. But it may also be something that is mixed in with the normal influenza vaccine. So as more experience around the world comes, I think this will be definitely a part of our lives for the next 5 to 10 years.
I'll go quickly to Dr. Manjunath ji.
And I think, as Dr. Gokhale said, I mean, the companies have already told there is some protection with the newer variant as well. Although there is a little bit of differences between both the vaccines, they said both are equally effective as well. I mean, but when you say new variant, they may not be 100% effective, but some effectivity can be seen because you already vaccinated for the primary strain. So what we going to say, another thing, I mean, I would like to add is mRNA vaccine, which they are talking about at the moment, which might start maybe end of this year, about working on that one. So which is more a sort of a different way of the vaccine it is, which can cover for the other strains as well. So yeah, as Dr. Koglade rightly said, there could be some strains to be added to the present vaccine, what we have, and they develop into the newer, sort of adding newer strains, which are really deadly strains of this. They might add into that one, and then we can have a booster doses or in a repeat doses of this. So there is still a search going on that one. So this is the start of it. This is starting point. And the next year, again, we're going to see, again, another different sort of strains added, newer vaccines, which we need to have as well. And we just want to see how this mRNA vaccine is also been talking about nowadays. So which might come into the picture as anyway. So there is a good, a lot of hopes and also a lot of, we can be at least sure that, there's some way to get around this vaccine, this virus.
Dr. Gokhale, one simple question. I got really 5 minutes now. I would like you to be very precise about this. Are we going to get herd immunity in next 6 months, 7 months or so? Are you seeing that happening after this vaccination program? You're on mute, Gokhale.
I think there has been problems with the vaccine rollout in Australia, but I'm very hopeful that in the next 5 to 6 months, especially with the current scare that we're going through in Victoria and particularly in Melbourne, I'm very hopeful that a lot of people will come forward to get vaccinated to provide that herd immunity. We still need a lot of people to have their full 2 doses of the vaccine.
Thank you so much, Dr. Gokhale. I got really 5 minutes right now. I'll give 1 minute to each of you to sum it up. What do you want to tell the community out there? And Indian Australian community should go there to get vaccinated or to be safe for themselves and their loved ones. I'll start with Dr. Sanjay Sharma. Dr. Sharma, what do you want to say to them? I got 1 minute. All right, 60 seconds for you.
So I basically want to provide 2 or 3 messages. Firstly, going back to the pregnant patients, I've had a little bit of input from my better half. So I'll say basically that pregnant women are 3 times more likely to get serious disease and require ventilation and ICU admission. So you would be better advised to get vaccination rather than not. And CDC in USA has said that it is pretty safe for pregnant women to have vaccination. So that's one thing. The second thing, regarding the variants, I would say the only sort of tool and strategy that we have against not having more variants is vaccination. If we want to stop the variants from occurring, we have to get more and more and more people vaccinated. And that will stop all this variation happening. So
I'll give you 20 seconds now.
that's the only thing that we need to do. Vaccinate, vaccinate, and vaccinate.
Thank you so much. Dr. Manjunath, what are your last words to people who are listening to us?
At the moment, vaccination is the only way. I mean, we can contain and control this virus spread. So even though side effects are expected, they are quite minimal. There are a lot of myths. Please don't listen to the myths. Some side effects are common, expected. They will settle. Don't worry about it. So just please, consider vaccination and then go for it, and also help in the herd immunity as well. Thank you.
Thank you so much for your time. Dr. Gokhale, your words, concluding remarks.
I just want to say a message that the Indian community has a lot of other comorbidities. We have a high rates of diabetes, high hypertension, and heart disease. So Indian people are slightly more at risk of becoming severely ill with COVID. So our community should get vaccinated, not only for yourself, but also for your family, so you don't infect your family and particularly your elderly parents. Many of us have elderly parents that live either at home or that we visit regularly. So vaccinate not only for yourself, but also for your family and for the greater community.
Makranji, last remarks from you, if you want to say something.
Yeah, I think it was a great discussion. And the closing remark from Dr. Manadar is very important because of the ethnic Indian population, what we have here in Victoria at least, and their pre-existing conditions and their vulnerability. So the important thing and the important message out of this webinar, and it will be available on YouTube and our Facebook page as well, is first thing, if you have any symptoms, just go and get tested. No questions asked. Just go and get tested. Come out and get tested. Second is check your eligibility on the DHSS website. Depending on the age bracket you have, consult your GP. Go and get vaccinated. That's it. Thank you very much.
It couldn't be said in a more enforced way than what Makran Bhagwatji has said. Thank you so much, all the panelists, for joining us. Dr. Manda Gokhale, Dr. Manjunath, Dr. Sanjay Sharma, and Makranji, thank you so much for joining us. And my message to everyone who's listening is, please, if you have symptoms, go get tested. If luckily you don't, then please get vaccinated for yourself and your loved ones and the community. Thank you so much for listening to us. Namaskar.